I'm Dr. Wolf, and I'm a forensic pathologist, which means I do autopsies to determine the cause and manner of death. And today we're going to talk about Hulk Hogan. The medical examiner recently certified his death as a myocardial infarction. And we're going to talk more specifically about that. And there were contributing factors of chronic lymphocytic leukemia and atrial fibrillation. So let's talk about definitions about how all of this fits together. First is the myocardial infarction, the cause of death. So myocardial means heart muscle, and infarction actually means death of the tissue. So an acute myocardial infarction is when heart muscle itself dies, okay? And how does that happen? Well, the heart is, of course, a muscular pump. It is actually, if you look at it under the microscope, it looks like muscle cells, just like you would see in a bicep. And what happens is that coronary arteries arise off of the kind of base of the aorta, and they spread out over the surface of the heart, and they nourish the heart muscle. So every time your heart beats, it sends blood into those coronary arteries, which then feeds it back to the heart. It's kind of an interesting and neat system. But what happens is when those arteries become blocked, either one or more of those arteries, which is usually by atherosclerosis, that can be from a blood clot or a thrombosis, then that blood can't get through the coronary artery, and it's like shutting off a pipe. There's no more flow to the heart muscle. And when that happens, the muscle begins to die. It usually takes a couple of hours to see it in the microscope, and then it progresses. And the longer you don't have flow, the more muscle will die. And the more muscle that dies, the less chance you have to live. And so what happens in an acute myocardial infarction, like how do they die, is usually one of two main scenarios. One is they develop an arrhythmia, so a very irregular or fast heartbeat, something like ventricular fibrillation, ventricular tachycardia, and there are other rhythms there. And those are not efficient heartbeats, so you can't get blood back to your heart, and you lose your blood pressure and you collapse usually. And the other is that a heart attack that's been going on for a few days can actually kill so much of the heart muscle that the muscle ruptures, and then blood spills out of the heart into the pericardial sac, and it basically constricts the heart. We call that cardiac tamponade. So those are the two main ways that I see myocardial infarction killing people. From what I understand, or what I could find online, and an autopsy was not done. So it would be pretty difficult to say acute myocardial infarction unless you had laboratory data. So for instance, creatine kinase levels, troponin I levels, something like an EKG showing the changes of a heart attack. But those are the main ways to diagnose. And of course, again, once you develop that arrhythmia, once you develop that heart rupture, death follows soon after. So what about the contributory conditions? First is atrial fibrillation. What does that refer to? Well, in older folks, it can happen in younger folks too, but it's very common in older folks where the atria, or the two top chambers of the heart, especially the left atrium, can fibrillate, which means it kind of beats more rapidly than it should. And those beats are not very efficient. They do not propel the blood as efficiently into the heart, and then from the heart to the systemic circulation. And so what happens is, the danger of atrial fibrillation is two things. One is that because the blood is pooling in the atria, it can form a clot. And when it forms a clot, then that's problematic, because that little pieces of that clot can break off and go up the carotid arteries into the brain and cause a stroke. So the main association with atrial fibrillation is stroke. The other thing is you can get a rapid ventricular rate. So in other words, the atria are beating very, very fast, faster than the ventricles, but eventually what will happen is the ventricles will respond just as fast. And anytime you have a heart rate that's too fast, that's very dangerous for your body. So those are the main consequences. As far as a strong association between heart attack and atrial fibrillation, you don't really think of it in that way. It's normally stroke is the main association, but of course, long-term atrial fibrillation can weaken the heart muscle, can cause congestive heart failure, and can again cause acute heart failure, which may be why the term heart attack or myocardial infarction was used. But what about the other diagnosis? Chronic lymphocytic leukemia. And you heard that right, leukemia is a cancer. But this is what we call an indolent cancer, meaning that it doesn't grow very fast, and it really just kind of percolates along. And it's very difficult for these to actually kill the patient. What happens is when they do kill the patient, the chronic lymphocytic leukemia develops into an acute leukemia, which can be rapidly fatal. But people can have chronic lymphocytic leukemia for years and years and not really have much other than something like anemia, not feeling so hot, a little bit of shortness of breath, fatigue, certainly. And so I think what they're saying in this case is that you've got an underlying cancer, which causes increased lymphocytes in the blood, is basically what it is. And when you have tens and thousands of lymphocytes in your blood, in every single micrometer of your blood, you're going to have a thicker blood, a more viscous blood. And more viscous blood is more difficult to pump by the heart. So it puts a little more strain on the heart if it's very, very high count. And in addition to that, heart condition of atrial fibrillation. So we've got two pretty serious underlying conditions terminating with a cardiac arrest, which is, they use the term myocardial infarction. Technically speaking in terms of medicine, we need to have proof that the heart muscle has died to make that diagnosis. But that's the basis of this case. It is what I would expect in this case. Of course, there are many different ways people can die in this scenario. Certainly, I would think autopsy or external exam with toxicology would be very important. You want to make sure that there's no substances within the system, prescription drugs, drug interactions, or things that can become sort of in toxicity and intoxication, like opioid medications and things like that. So if you have any questions or comments or concerns, please consider putting them down below. Write a comment. I'll try to get back to you if I can. And if you're interested in true crime, forensics, pathology, medicine, medical school, learning, medicine in general, then consider subscribing to this channel. Turn on the notifications with the bell so that when I make a video, it'll alert you in your inbox or it'll alert you in your notifications and you can come and watch the video. And please share this for anybody who might be interested in learning about the cause of death for Hulk Hogan. Thank you.